Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, August the 10th. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written report, as we will Wednesday, on case counts and other relevant issues with COVID-19 in British Columbia. On Thursday, we'll be providing another in-person briefing that will include some new information about our research into COVID-19 in British Columbia on Thursday that Dr. Henry will be providing. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So today we're reporting on 3 periods from Friday to Saturday. We had 50 new cases. Saturday to Sunday, there were 37 people identified with COVID-19, and from Sunday to today, an additional 44 people. That brings us to 131 new cases in the last 3 days, including 1 epidemiologic linked cases, bringing our total in British Columbia to 4,065 people diagnosed with COVID-19. That includes 1,220 in the Vancouver Coastal Health Region, 2,139 people in Fraser Health Region, 148 people on Vancouver Island Health Region, 391 people in the Interior Health Region, 96 people in the Northern Health Region, and 71 people who are here who reside outside of Canada. We now have 445 active cases across the province, including in all health authorities, of whom 9 are in hospital currently, 3 of whom are in critical care or ICU. We have had no new deaths over the last 3 days, leaving our total at 195 people who have died from COVID-19. In addition, we have 3,425 people who have recovered, and we currently are following 1,765 people who have been close contacts of a case of COVID-19 are under active daily follow-up with public health. Over the weekend, we have had 2 new healthcare outbreaks in the Fraser Health Region, one of which is at the George Derby Centre, long-term care facility. So this is a centre that is separate from but related to the Derby Manor outbreak that we declared last week. As well, there's an additional case at the New Vista Care Centre, and Fraser Health is on site with teams responding actively to all of those outbreaks. That brings us to 8 now active outbreaks in our health system, 7 of which are in long-term care or assisted living, and 1 in acute care. There are 673 cases associated with these outbreaks in our health system, 406 residents and 267 staff involved. We have no new community outbreaks. However, we continue to see exposure events, and those community exposure alerts have been posted on health authority websites, as we know. There have been a number of new locations over the past few days, and a number of new flights where people who have had COVID-19 have been on board coming into and out of British Columbia. So please check each health authority website and follow the guidance of public health teams. I do want to say, though, that we have been working, as I talk about a lot, the contact tracing that we're doing and how the management of people who have COVID-19, every single case is followed up and linked, and that is working. The numbers that we see from the past few days have reflected the intense work that my colleagues across the province in public health are doing on tracking down those people who were at those events, many of them young people at social events where they intermingled. And we're doing what we call social network analysis to make sure that we're finding people. And many of those people, the vast majority of the people who tested positive over the past 3 days were people who were on our contact list, who were amongst the 1,500, 1,700 people who are in active daily follow-up. And that means that as they developed their illness, they were isolated and they no longer exposed others, breaking those chains of transmission. This is incredibly important because this is how we know we can manage with the cases that we're seeing here in British Columbia. Having said that, We need to do better collectively to stop these exposure events from happening. Our layers of protection reduce the spread of COVID-19. We know that works. We know we can do it. We help all of us stay safe, whether we're at work, at school, out with friends. What I can tell you is that parties and gatherings with young people that many of whom you don't know, even if there are fewer than 50 people, are a concern. And we have seen that. We saw that on the July 1st long weekend. We've seen it across the province where people have been coming together and having group gatherings with different people and not maintaining distances, safe distances from people they don't know. This is because people are often inside and in close contact with crowds of people that they don't know for several hours. And we've had a little bit of some work being done by teams across the province to ensure that some of these parties have been broken up, including there have been some fines levied on some as well. We know that when alcohol is involved for many, the precautions that we would normally take can diminish. So if your friends invite you to a party and it doesn't feel right, don't go. There's no better excuse than a global pandemic to be able to do the right thing and encourage your friends to do the right thing too. As well, we need to remind people that these are there, these guidance and these documents, these orders that are in place are for all of our protection and for protection of our community here in BC. And so when people are traveling here, if you're visiting from other provinces or from out of country and you finished your quarantine, do not ask people to break these rules. They are there for the safety of everybody in establishments like restaurants and bars and other places. We need to be in this together. We need to keep our group small, and we need to support each other in keeping these layers of protection in place. We are in a time when we know people can unknowingly spread the virus to others, particularly young people who are feeling well and may quite easily spread it. And these are why these precautions we take right now are important for all of us. And these next 2 weeks will again be critical for us. We need to hold our line and bend our curve back down where it belongs. As we increase our time with others and restart activities across BC, I know that spending more time with others can be a source of anxiety for many. And that's why we have to pay attention. In particular, I know parents and families are worried about the restart of in-class learning in the fall. This anxiety, this fear, this not knowing what it's going to look like in the face of a global pandemic is perfectly normal. We are all feeling that, and I understand that. Schools will look different. We have to put aside what classes were like in March or even in June, and we learn from what we know about this virus and about how it spreads and about things that we can do around the world. It's important to remember that the layers of protection we use at work, at grocery stores, in restaurants, will also be used in our schools. That is part of the plan. They are the foundation and the backstop for all of us. Limiting the time with others, using one-way pathways, cleaning more, washing hands regularly, and always, always, always staying home if we're unwell are important measures that will be used in our schools every day. Reducing the numbers of people in the school, and that's parents and others who would normally come in, staggering times, use of distances, keeping groups smaller, making sure that the number of people who are in a group are maxed at a certain number, using masks when it's appropriate. These are all things that we will be doing in our schools. But we need to come together locally and make the framework that we've given out work for all our children in our local situations. And that work is being done now, and parents can be involved in that. The Back to School plan has been developed to ensure that these layers are there. Like for every other sector, we've worked with the Ministry of Education, with teachers, with parents, with school districts, to have a framework that every school then needs to adapt to its own situation, its own community. And that is what is happening now. Each school and school district is now taking the overall framework with the guidance in place and applying it to their schools. This will ensure the layers of protection are there from the first day to the last day of the school year. You will see such things as staggered start times, staggered recesses and lunches. And we talk about the layer of learning groups. That means that it may be that 2 or 3 classes all start at the same time and have recess at the same time. It doesn't mean that all of those children will be intermingling every day. It means they may go for recess at the same time, but they'll be in different areas of the schoolyard. We will be looking at the important innovative things that teachers and parents and schools have been thinking about outside classrooms, about how they can increase ventilation, how they can safely have smaller groups, and how we can have physical distancing, and in particular making sure that we're not having physical contact on a regular basis, particularly for young children. So each school district and school will be developing their own COVID safety plan within the framework, and that's what parents and teachers and the rest of us will be looking for in the coming weeks. We need to work together, and we need to use all of those great ideas that are out there to make sure that this is safe. It is that important for our children and for the future that we are able to manage this and make sure that our children get what they need in their education system coming into the next year, because this virus is going to be with us, and we need to be able to manage it and support our children. COVID-19 has created incredible uncertainty and concern, and all of us feel that. But let's not forget, we have shown how to slow the spread of this virus, and we know we can keep our communities safe. It's about monitoring closely, doing our part to minimizing the risks, managing the number of new cases, and that's something that we do in public health with you, modifying our actions as needed. We will be flexible as we move forward, and we will learn from every outbreak, every encounter we have. This is what will keep us safe and protect the people that we care for, and protect those most at risk, particularly our seniors and elders. So let's keep going. Let's all do our best every day, each and every day. And let's also continue to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. And of course, we are gratified that over the 3 days of the weekend, no one has passed away from COVID-19. We remember the 195 people who have passed away since the beginning of the pandemic and their families. We note that there are fewer people hospitalized than there were on Friday. I think that's from 11 to 9. There are fewer people in critical care than there were on Friday. And yet, there are, of course, more cases, 131 more cases over the last number of days. And this is the circumstance and this moment in the pandemic that we're in that Dr. Henry, I think, has just described very well. It's a moment in the pandemic where we've reduced the number of people passing away from COVID-19. As an example, 8 people have passed away in the last 4 weeks in British Columbia, and we mourn them. 48 have passed away with a smaller population in Alberta, and 272 in that time in Washington State. And that just tells us a little bit about the nature of the pandemic in these different places, and that everyone in those jurisdictions, as here, are struggling with their specific circumstances. And our specific circumstances include, as you can see by the case numbers and how they've been described and how they're shown on the BC CDC dashboard, which goes out every day, is relatively speaking, younger people testing positive for COVID-19. And when we talk about younger people, we're talking about people between 20 and 39. And so I think it's not fair to describe or ascribe all that to youth. There are people in those categories with lots of experience who are struggling with this. Nor is it fair, and we don't do this, to blame those who have tested positive. There are people who may have gone to parties that didn't test positive, that aren't sick, and their circumstances, and the circumstances of those who are, should be the subject of care and not the subject of scorn. But that said, we do need to continue, and as we've noted before, to take action, the very actions that are required. Some of that will require enforcement, and you've seen some of that over the weekend. Some of that will require all of us reaching out to the people we know, and some of it will involves our individual actions, our saying no to going to private parties of a sort where we don't know everybody, and saying no to organizing such parties. And I think that's something that we can help each other with in the community. And to do that, we are and will be finding people on social media and influencers. But I want to say to everyone out there, we are all influencers. And we can all influence the behavior of ourselves, first of all, but of the people around us, and how we behave, how we say no respectfully to behavior that is unwise in the context of a pandemic and goes contrary to the advice of Dr. Henry, is an important way that all of us can participate in stopping the spread. Today I'll be providing my weekly update on PPE. To recap our cumulative totals from March to last week's report on Tuesday, August 4th, the following PPE has arrived in BC. Just over 6 million N95 or equivalent respirators. That's 5% of which comes from the federal government's bulk procurement. 36 million surgical masks or procedure masks. 2,400,000 pieces of eye protection, including goggles and face shields. 75 million pairs of gloves. 4,700,000 gowns. Many of the items I just listed are in our ongoing testing processes to make sure product meets or exceeds safety requirements being used in BC's healthcare system. Today I can tell you that over the last week, since my last update on Tuesday, August 4th until yesterday, we've received the following. 41,437 N95 or equivalent respirators, 6 million, that's 6,253,750 surgical or procedure masks, 2,145 pieces of eye protection, 977,950 pairs of gloves, and 871,950 gowns. We'll, of course, continue to source and test our PPE and are working hard to pursue any and all credible leads for safe and effective product, as well as working with the private sector and other jurisdictions in Canada, including the federal government, to develop domestic suppliers. In closing, I want to say this, that our task this summer was to renew BC without rebooting the virus. Our number of new cases is climbing, and it's climbing to levels that we haven't seen in a number of months. The number of people now in self-isolation is disturbing. While some increase was expected, each of us knows our numbers are too high. And we probably think that 10 is too high, but certainly approximately 44 a day is too high. And that by doing so, we have the potential of undoing the work we've all done. And that while people may think that these things aren't linked to vulnerable people, in fact, we know that they are. There are about 150,000 people who work in our healthcare system, 47,000 people who work in long-term care. If there's more community transmission, inevitably, it's going to affect people who work in healthcare, who work with some of our most vulnerable people in societies. And that's why we have to make sure we're still 100% committed when it's just us, out by ourselves buying groceries, stopping in at a coffee shop or running errands in local stores. We must make sure we're 100% committed when it's with those in our bubble and we're getting together in our homes and our parks or our restaurants. We have to be committed to taking the actions we need to take, following the advice of public health officials, following the advice of Dr. Henry, and doing the right thing. We've all got to use our COVID sense. We need to use it every day. We need to say enough to private parties where alcohol is being used that where physical distancing is impossible. We simply have to say enough. And if those we care about need a reminder, or we encounter somebody who's not using their COVID sense, that's when we use our COVID courtesy to kindly and firmly help them stop the spread too. In our BC fight, we count on each other. Right now, each of us has to use the influence we have, the trust we've earned, and the bonds we've built with family and friends to reach out and make sure that across BC, we're all recommitting to the behavior that works. Use our COVID sense, show our COVID courtesy, stop the spread. When we let our guard down, we invite COVID-19 into our homes. It's time to take in that welcome mat. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 7 et 8 août, celle des 8 et 9 août et celle du 9 jusqu'au 10 août en mi-journée. Nous sommes reconnaissants qu'il n'y a eu aucun des nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous continuons à offrir nos condoléances aux familles et aux amis des 195 personnes décédées du COVID-19 et tous ceux qui ont perdu des êtres chers au cours de cette pandémie. À ce jour, 3425 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, jusqu'au 8 août, nous avons eu 50 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 9 août, nous avons eu 37 nouveaux cas. Au cours des dernières 24 heures, 44 nouveaux cas se sont ajoutés. Cela représente 131 nouveaux cas depuis notre dernière mise à jour vendredi pour un total de 4065 cas en Colombie-Britannique. Parmi l'ensemble des cas confirmés de COVID-19, 9 personnes sont actuellement hospitalisées, dont 3 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you.